Organizations have realized how important the physician voice is in changing the health system. And I think what is emerging is the importance of the patient voice.
You can't start with every Canadian. You have to start with communities. And the experts of research need to actively work with the place where clinical activity happens, and also the patients and the people that work in those environments.
Research is becoming more qualitative rather than quantitative. So the qualitative captures the richness in the language of how patients describe their experience.
I think the guiding principle or mandate for the SPORE is mentoring. So if people who are mentored, the anxiety will be lowered.
There are mechanisms that will support family doctors participating in that research with their patients or informed by their patients that don't have to be as time-consuming as I imagined it would be, say, 10 years ago.
The days of one individual starting a question and individually coming to an answer that gets published is over. And the SPORE process was purposely set up to mitigate that.
As a clinician, my priorities are seeing patients and treating patients. And if there is a team, which we have a team right now, it's some time dedication, but it's not a huge burden.
The patient population I see here on the island is very different than if I was working in Prince George or Vancouver, and so I think the data that we'd get would be more applicable to my patient population if the patients that are involved in the research process are from the same pool.
The way that this is hopefully going to be set up is that busy clinicians participate by becoming part of a network. So locally, we have a great example of the partnerships, and that is between the University of Victoria and the Island Health Authority. I've seen it work where they are meeting, where they are including patients, and where they are interested in making the dream of the SPORE a reality.
The answers we want would be things that we can then feed back to our own clinical practice. So I think having patients involved locally is more likely to keep things on track.
I think the research office has been instrumental in terms of getting all the pieces together.
A lot of patients, the research is about them, but they're not actively involved.
This is an incredible opportunity for them to have a voice, to actually influence what research is all about in terms of outcome.
I think patients are interested in their own care, and I think that family members are interested. This work that SPORE is doing is part of that, moving this forward and involving a network of people all directed towards the same common goal.
If you want to advance any field, you got to have research. If you don't have research, then you don't have what we call evidence-based medicine.
How we practice in 10 years from now is going to have a lot to do with the questions we're asking now and the research we're doing now to try to answer those.